One of the most heartbreaking patients I have treated is a child who was having multiple types of seizures, not just one or two, multiple types. And he kept falling day after day. And every time he falls, he will break his front teeth. And then his family will go to the dentist, replace them. And then a few months later, he will fall again. And then a few months later, will fall again. They keep replacing them until one day his dad said that we stopped replacing them because every time they just go back and then from many surgeries, things were not appropriate there. It's called Lennox-Gastaut syndrome. And it's kind of one of the most difficult types of epilepsy to manage and has lots of other issues than just seizures. So let's talk about details about Lennox-Gastaut syndrome. What is it, how we make the diagnosis, and what impacts it has on the patients and the most importantly on their families. It affects the whole family and we will talk in details. And at the end, we have hope of future studies that will bring better treatments for this type of epilepsy. And welcome to Epilepsy Encyclopedia. I'm Dr. Omar Danoun, an epileptologist or epilepsy specialized neurologist. And in this channel, you will find all the information you need to live a healthy life with seizure freedom. So what is Lennox-Gastaut syndrome? So Lennox-Gastaut syndrome, or we call it LGS, is a syndrome that has multiple types of seizures. So there are a few things to make the diagnosis of Lennox-Gastaut syndrome. So first of all, it's a childhood epilepsy that starts in early childhood. Usually the age is between 2 and 8. Most of the time, seizures will start before the age of 10 years old. And it has characteristic types of seizures, usually multiple types of seizures. The most important one is tonic seizures, when the children will stiff up one arm or the whole body, and they can have other types of seizures, what we call atypical absences, when they have like staring and unresponsiveness, myoclonic jerks, they will all jerk or one side of the body jerks, spasms, especially in little children and babies. And it can be also drop attacks, which is atonic seizures. And that's one of the most devastating type of seizures because the children will fall to the ground with absolutely no control over their body and they get injured. And the generalized tonic-clonic seizures, the typical grand mal seizures when shaking all over happens. Also, there are other aspects with children like developmental delay, intellectual disabilities, behavioral issues, sleep problems, and multiple other issues that can happen in children with Lennox-Gastaut syndrome. And at the end, also, there is an important changes on EEG. We call them slow spike and wave discharges and paroxysmal fast activity. That is a characteristic findings we find on EEG. And one aspect of Lennox-Gastaut syndrome that most doctors and people, when they speak about, they just talk about the seizures and the medications, and they forget about this, the human aspect. So I pay lots of attention to my patients and their families, and I see there is lots of like struggle from the whole family when they have a child with Lennox-Gastaut syndrome. It's a difficult type of epilepsy. You're always worried about your child falling, hurting themselves. When you go play or do anything, this is on your mind all the time. When you're dealing with behavioral issues, when you're dealing with intellectual disabilities, schooling, special needs, lots and lots of things that will affect the whole family. So kudos to all of you who have children with Lennox-Gastaut syndrome. You are the real hero in this story. And one of the aspects of Lennox-Gastaut syndrome is this fall attacks or atonic seizures. And that's why children will end up wearing a helmet. What happens is that there is a sudden drop and loss of muscle tone. Like all the muscles will just switch off, and the children will fall to the ground really hard. So it's kind of battle between the child and gravity always wins, unfortunately. And the children, because they have absolutely no tone in their muscles, they will fall like a wood or like a closet. They will fall face down without ability to hold themselves or protect themselves. Imagine like if you trip and fall, you will put your hands, right? It's a reflex, right? But the children of Lennox-Gastaut, they have complete muscle lack of tone, so they will switch off. They just fall down. They cannot protect themselves, and that's why they cause lots of injuries especially to the face and head, and we see cracked skulls and fallen teeth and lots of injuries because of that condition. So that's why lots of people will end up wearing helmets and staying in a wheelchair because of the many falls. So what is the cause of Lennox-Gastaut syndrome? There are multiple causes, and that's why it's called a syndrome. It's kind of an umbrella that comes from many different routes. One of the important causes can be genetic causes, which means there is a gene mutation, there is a problem in the electricity control in the brain or the build of the brain, and causes Lennox-Gastaut syndrome. So that's one of the important causes is genetic syndromes, and we have like an umbrella called developmental epileptic encephalopathies, DEE. And then we have other things that cause structural issues, means problems in the build of the brain, like neonatal asphyxia, neonatal stroke, lack of oxygen, or the malformation in the brain. The brain did not form right for any reason while the baby was developing in the womb, while during pregnancy. This all can cause issues with the electricity, leading to Lennox-Gastaut syndrome. Also, metabolic disorders in the metabolism or tuberous sclerosis, it can lead to Lennox-Gastaut syndrome because it affects the build of the brain, and it can be also severe infections that cause damage to the brain, leading to Lennox-Gastaut syndrome. And sometimes we start in babies as like West syndrome with infantile spasm, and when they grow up, they will turn into Lennox-Gastaut syndrome. So it's kind of matures over time. Sometimes we have seizures, and then after that it changes to something else over time. So that is why testing for genes, and now we have much better genetic testing called whole exome sequencing and epilepsy panels. It is very, very important to send that, because sometimes the genetic testing can reveal the diagnosis, reveal the cause, and that can help us in finding the proper treatment that is dialed only to the genetic syndrome they have. Also, we do a brain MRI to see if there is any malformation or issues in the brain that caused the syndrome. And sometimes in rare cases can be a candidate for epilepsy surgery if there's only one area of the brain that is affected and causing the seizures. But most of the time in Lennox-Gastaut syndrome, the MRI will be normal. And the problem is not like the whole structure of the brain, it's the connection and the networks in the brain that are affected. So what does the EEG look like in Lennox-Gastaut syndrome? So the EEG can be showing this characteristic slow spike and wave, which is about 1.5 to 2.5 hertz. And the EEG will be also showing background slowing, and it can show this characteristic paroxysmal fast activity all over the brain, especially during sleep. And this is characteristic EEG finding that we see as doctors, or you can read in the reports, that is characteristic of Lennox-Gastaut syndrome. So why LGS is very difficult to treat? The causes of Lennox-Gastaut syndrome, they are genetic, mostly ingrained inside the brain. The brain is built with abnormal networks that cause seizures to happen. Very, very difficult to control them. And it can be also these chatter is all over the brain in multiple areas, not just one area, many areas, and they are involved in lots of functions. So that is why it can be very difficult to control. What are other symptoms of Lennox-Gastaut than just seizures? As we said, we have so many symptoms with Lennox-Gastaut syndrome than just seizures. Seizure is just one aspect. They also can have, as we said, difficulty in cognitive function and intellectual disability, developmental delay. They might not be able to grow mentally. They will get, so kind of like somebody is 20 years old, but their brain is just developed at 5 years old or so. They might not gain milestones. And also they can have other things like imbalance and decreased balance. They will have wobbling, and that also will exacerbate injuries and falls. Swallowing issues can happen in children with Lennox-Gastaut. They have like weak muscles of swallowing, and that can cause aspiration and pneumonia, and that can be dangerous. Also drooling. Drooling is a big issue in children with Lennox-Gastaut. It has multiple reasons why it happens, but drooling happens so much. There are lots of secretions and drooling happening. It can be side effect of medication or the syndrome itself. And we treat it by anti-drooling medication that kind of dries the mouth. I don't like to use them a lot because these medication can cause side effects on the brain and be sedating. I prefer to use Botox. Imagine like Botox works very well for these children. We inject the Botox, which is a neurotoxin that can stop the nerve from activating the saliva glands. And we do them in the parotid glands and sublingual glands here and here. We do injections in all the salivary glands, and it works very well. And you just bring the child every 3 months, and Botox works really well. So I had lots of success in Botox and drooling. Because of the falls, the injuries, the aspiration and pneumonia, unfortunately, children with Lennox-Gastaut, they have a lower life expectancy, means that they die earlier because of all of these complications. So what are the treatment of Lennox-Gastaut syndrome? So we have multiple medications that are even FDA approved for Lennox-Gastaut syndrome. And the most common one, or the first line, is valproic acid or Depakote. This works well for multiple seizure types, and it does have multiple side effects. There is a whole video about every medicine that I will mention, so you can go in details with these videos. But in general, valproic acid can cause weight gain, can cause sedation, it can cause liver toxicity and other side effects. The second medicine is clobazam or Onfi or Frisium in other areas of the world. So this medicine is used a lot for Lennox-Gastaut syndrome and as FDA approved, but it does also can cause side effects, especially on higher doses, 20 milligram twice a day or higher. Drooling can happen a lot, sedation and sleepiness, and even some allergic reactions. And the good thing is that this medicine can help with drop seizures. The other medicine is lamotrigine or Lamictal, works very well for Lennox-Gastaut syndrome, has minimal side effects. The most important consideration is to have slow titration and building it up over time, and it does interact with other medications and can cause allergic reactions. So these are the main highlights. The other medicine is rufinamide or Banzol. This medicine is kind of specific for Lennox-Gastaut syndromes, and it does help, especially with drop attacks, and it does help with other types of seizures. And the other medicine is topiramate or Topamax. It can cause issues. Like it works for seizures, but it can cause cognitive issues as well, worsening of that. It can cause kidney stones, so it's important to make sure the child gets enough hydration and fluid to avoid kidney stones. And then the medicine that everyone talks about is cannabidiol or Epidiolex. So it's important that Epidiolex is given because it's a purified type of CBD that is pharmaceutical grade. So I don't like to give dispensary marijuana or over-the-counter marijuana from Amazon or somewhere, because these can vary so much in the dosing. So now we give Epidiolex, which is a pharmaceutical grade medical marijuana. It does also have side effects as well. It can be toxic to the liver, cause diarrhea because it is an oil, sesame oil mixed, and it can cause also excessive sedation. So it's very important to notice these side effects. Other medicine is fenfluramine, which is called Fintepla. So it's relatively also a new medicine that is approved for Lennox-Gastaut syndrome. It can work for seizures. We used to have heart monitoring, and hopefully it will go away in the future. And there are other medications we use for Lennox-Gastaut syndrome, like carbamazepine, Tegretol, or other medications. And most of the children will be on multiple medications. We try to avoid more than 3 medications, because when we combine multiple medication, it can cause issues and exacerbation of side effects without significant benefit. I myself noticed there is a huge improvement, and with this new medicine called cenobamate or Xcopri, works very well for Lennox-Gastaut syndrome, especially the drop seizures. So this medicine works very well. We will learn more about this medicine in the future. I made a whole video about that as well. You can learn, but cenobamate will be a good medicine for Lennox-Gastaut syndrome, especially in the future. Other treatment will be diet therapy. So diet therapy or ketogenic diet is very important asset in the treatment of Lennox-Gastaut syndrome. Because we feed the kids, it's easier to adapt. So what we do is we will give higher doses and higher concentrations of fat and proteins, and much lower concentration and portions of carbohydrate that will force the body into ketosis, and these ketone bodies and acidity will help with the seizures. And there are multiple versions of the diet, like ketogenic diet, modified Atkins diet, or low glycemic index diet, or MCT oil. All of them are successful in helping patients with the Lennox-Gastaut syndrome. And other treatments can be surgical treatments, and there are more conservative surgeries like the vagus nerve stimulation, as we explained in a whole video about that. So we will implant the device, and the wire will go in the neck, and it will help with the seizures, especially the drop seizures, and it will lower the seizure intensity and frequency. But it is considered a palliative procedure because it does not stop the seizures 100%. Other treatments is deep brain stimulation, or DBS. We target one specific nucleus than the normal DBS. It's called the centromedian nucleus in the thalamus, and that nucleus is helpful in Lennox-Gastaut syndrome. And we have successful patients who did that and worked very well for them. And other surgeries can be the corpus callosotomy, which is disconnecting the two sides of hemisphere. The corpus callosum is kind of the highway that connects both sides of the brain, and corpus callosotomy will cut that highway, and that will prevent the synchronization and drop attacks. And it works very well for people who have severe drop attacks. It used to be done with open cut. Now we can do it with microscopic surgery, or now with laser ablation. You can put the laser and do the corpus callosotomy with laser, which can be much safer. And the conventional epilepsy surgery, which is cutting out brain areas, most of the time it is not utilized in Lennox-Gastaut syndrome because it is multifocal condition and generalized all over the brain. So if you cut one area, the other areas will be taking over. So we do it very rarely, and if we have like a malformed hemisphere or something, and the earlier we do it, the better the outcome will be. So whenever we think about treatment success in Lennox-Gastaut syndrome, we don't just count how many seizures the child have. We think about the holistic approach. We think about how many falls they have, how many injuries, if we prevent SUDEP and sudden death in epilepsy patients. All of these things are successful parameters that we think about when we think about children with Lennox-Gastaut syndrome. So it is very important, because it's such a complex condition, to have the right diagnosis, right tools, and right treatments and combination as well. For that, I offer the consultation, the remote consultation that you can do for adults 16 years and older. Of course, not children, because I'm an adult neurologist. So you feel free to check the link below, and we can do one-on-one consultation and give you the best treatment plan for you and your children. What is the future for treatment of Lennox-Gastaut syndrome? The good news is that we have multiple clinical trials that are looking into treatment of Lennox-Gastaut syndrome. Some of them are surgical, some of them are medical. So there are, and I am myself part of multiple clinical trials that are specifically studying the treatment for Lennox-Gastaut syndrome. We have treatment with responsive neurostimulation RNS device, so it's kind of type of a stimulation surgery. We have second generation anti-seizure medication like relotrigine, soticlestat, and carisbamate. And there is even a medicine that was given before in the 60s for allergy, called clemizole, being studied now for Lennox-Gastaut syndrome. So there are multiple new studies that have been done to hopefully bring better treatment for Lennox-Gastaut syndrome. Other promising treatments that are new and coming on for epilepsy that you can see in this video, for all the exciting treatments, including genetic studies, potassium medications, and even stem cell therapy, all to hopefully give better treatment for people with epilepsy. But also, the early detection and prevention of Lennox-Gastaut syndrome is important, and one of the first signs that the baby might be developing Lennox-Gastaut syndrome is West syndrome, and I explained that and the right treatment for it in this video. You can see, and stay healthy, and see you in the next one. Salam.